Hi guys, Dr. Arun Panda once again, and we are towards the fat end of our hair restoration and hair transplant workshop. And this time we had super participants all the way from Assam and Kerala. So let us have a quick review of what they have learned in the last 3 days and what are they taking back from us, guys. Thank you so much for coming to us. And I really enjoyed your company, especially your company, Dr. Hemanta, and you really taught us a lot of things. Being from a dermat background, you shared so much of a knowledge with us. I'm really thankful to you. You came here and shared, and you all actually helped us all to learn so many things. Thank you so much. Let us take a quick review of what. Where do we start from? Let's start from Dr. Jason. He is a maxillofacial surgeon from Amrita Medical Institute in Kerala. And let us see, Doc, you from a maxillofacial and onco background, you have come to learn hair transplant. What made you to come and go into a field which you had never explored? So what would you like to, what were you thinking and what has made you to, kind of get into this? And are you looking forward to probably have a part of your career into this, or how is it going to be?
We would definitely want to incorporate hair transplant in our department and practice.
Right.
Yes, so since there were a lot of patients who had come to us and had asked us about hair transplant, and we thought it was about time to learn. We sent back so many patients. So we thought we should at least have a very good idea and start doing it as soon as possible in the department.
Great.
And this course has certainly given us the confidence to start immediately once we get back.
Right.
So the 3-day workshop was a great experience and it was very comprehensive. And especially Arun sir and Arun sir's team, they were really pleasant and enterprising and very comprehensive. Sir was very comprehensive in his teaching, and even Dr. Sir's assistant.
Yeah.
Yeah, she was really good. She really helped us while we were doing the hands-on on patients.
Good.
Yes.
So what else you didn't like about us?
No, I liked everything. I liked the food.
Okay. Maharashtrian food.
Yeah, I love the food. Food was good. The only thing I didn't like was the shoes.
So we'll try and do something else for the shoes tomorrow.
Bigger
shoes.
Yeah. That's the only thing.
Great. So I think for you, bigger size should be there. I think. Yeah. Okay, great. Thank you so much, Dr. Jason, to come here all the way from Kerala. Let's go to Dr. Giri. So again, I would ask the same question. Maxillofacial background, getting into hair transplant. Where are we standing?
Like Jason said, my colleague. So we are into almost all other maxillofacial areas, trauma, all these things. So we are lacking behind all this. We are lacking behind in this particular
aesthetics, cosmetics.
So we thought we have to step into this thing, and so that because patients are waiting.
True.
So we have to learn this, and so thank God sir is giving us opportunity because he is giving this. Because we got an opportunity to come and learn this from sir. It was very good because like explaining things very lightly, so we can know all these big things in a small way, in a nutshell. All this very cumbersome thing has made it to a very small thing. And hands-on also it was very good in this 3-day workshop. We had done a lot of hands-on. He allowed, and his team, especially his team, Aditi ma'am, his Anjan, all his team was very good, very helpful in many ways. It was a very good experience. So we are planning to start our thing immediately when we
look forward to you guys doing a lot of work.
And definitely we'll get back to you, sir, our results.
Yeah, that is important. You should keep on posting the results. Wherever I can, kind of help you out.
And anyway, your help has to be there.
Lifelong. That is not a problem. Lifelong I am standing with you guys. So anytime we are always there. Thank you so much, Dr. Giri, to have joined us here. Let's go to Dr. Hemanta, who has come all the way from Assam. I guess you have a big dermat practice there. Big dermatologist there.
I just started practicing.
Yeah.
So I was practicing mainly clinical dermatology,
Right.
a little bit of cosmetology. I'm interested, and I was planning to start hair transplant. So very little people are there in my region, my side, mainly dermatologists who are practicing hair transplant. So I wanted to learn it. So why not learn from the best from India?
Oh, so sweet of you. Thank you so much. Thank you so much. That's a real big compliment,
Yes.
sir.
So I came here and it was a very good experience for whole 3 days. Apart from everything, sir was very much approachable. You made everything very simple. From the starting day, you were telling that everything is very simple. Though it is not so much simple, but you have made it along with your whole team. You have made it so much simple. And I'll be in constant contact with you for my lifetime.
I am standing behind you.
Yeah.
Not a problem at all, sir.
So everything was good, and I'll definitely recommend if anyone come to me or for any future references, I'll definitely recommend you, sir.
So you know what, the biggest compliment for me would be, I mean, if you do a lot of cases and if you can share some photographs and wherever I can help you.
Sure.
And the only thing I can, wish is you do a lot of cases and that you should be the best in your region.
Thank you.
That is the only thing I look forward to, you guys.
Thank you.
Thank you guys for joining us here, and I really appreciate your efforts to have come so far. I know Mumbai is not very far, but and I hope you guys are taking back a lot of stuff from us. I've given almost everything to you guys. So day after tomorrow, you should start your cases. Yeah, so I look forward to see you guys doing great in your practice. And thank you once again for joining us here. Thank you so much.
Thank you.
Bye.